Guys, welcome back to this channel. If you're new here, my name is Belinda Strana. Thank you so much for all the love and support. Don't forget to please subscribe to this channel, turn on notifications so that anytime I upload a video, you will be the first person to be notified. And to my returning subscribers, those people that share my videos and also educate you guys are the real MVP. Alright, lovelies, let's dive in into today's video. Lovelies, I came across this video on my For You page on TikTok and I thought to share with you guys where a lot of people are reacting to the fact that healthcare is something that people really need to survive. A lot of people were like, oh my goodness, this one that we were actually paying this ridiculous amount of money for healthcare, and now they want to remove Obamacare or affordable care. It's going to actually be an FA and FO era. I'm just going to roll the clip as well as some of other stitches I was able to put together. Please leave me your own thoughts in the comment section of what you think of this video. Alright, lovely, let's dive into it.
This fuck around and find out is that I have to find out even though I didn't fuck around.
You know what I'm upset about today? Healthcare. I have spent the last few years putting off getting some dental work done because my priorities financially have been getting my son's health taken care of and court for the DV case against his father. So all the extra money, even though I'm not struggling, has gone towards my son, his tuition, his genetic testing, all that kind of stuff. I pay $400. More like closer to $500, about $250 per paycheck for us to have medical, dental, and vision insurance through my job. And I went to the dentist today for a limited appointment because I have 2 broken teeth on the upper left side of my mouth, and one of them is a wisdom tooth. I never got my wisdom teeth taken out because they weren't growing in crooked or anything, so the dentist said it wasn't a priority. And so one of them's a wisdom tooth and the other one is a molar. And guess how much it's supposed to cost me to fix those 2 teeth with dental insurance? I'm going to show you. I am supposed to pay $1,900. They tried to schedule me for tomorrow, and I had to tell them no. Like, first of all, it doesn't work with my schedule, but 2, like, I'm supposed to be able to make a split-second decision on whether or not I can afford right now to pay $1,900 for 2 teeth, and really it's for 1 tooth because my wisdom tooth is just getting extracted, which is about $43, which means that the other tooth is all of those costs. Am I supposed to keep suffering with broken teeth? No. So then I do what? I spend this $2,000 on this when that $2,000 can go towards my kid or other bills. I just, like, what am I supposed to do as a single mom who is literally just, and I make good money, like I make good money. Anybody else, in any other state other than California, I would be living incredibly, I don't know what to do. It's like I pay for insurance and that should make it where it's not as expensive. It just freaking sucks.
Why am I paying $500 a month for health insurance that doesn't want to cover anything? Every single time, new medication, this, that, they're like fighting everything. They don't want to pay for it. They say, oh, you need this, you need this. It's like, I thought having better insurance meant things would be easier. I don't know what's happened. I know health insurance has always been kind of scammy, but like in the last 5 years or something, or even more recently, I don't know if it was from COVID or what, but it's like they don't want to cover anything. They are just shamelessly stealing people's money. And I think the worst part about it is when you see these commercials and these ads and they're like, we care about your health, or like, Blue Cross, like we care about you, or Healthy Life, or Kaiser, all these people that are saying they want to help you and they want you to be healthy, they don't. They really don't. They just want your money. They don't want to pay for shit. To add insult to injury, when you get the bills of these things, they just mark everything up like the most ridiculous stuff. It's like a spit test or something like that. And they're like, that was $40,000. We saved you $40,000. It's like, on what planet was that actually $40,000? They're just making these numbers up to say, oh, see, you had these savings. It's like, no, I had to pay hundreds of dollars for this test. Anyways, when the test probably cost less than that, but you're saying it costs, this insane amount of money. They're like, well, we saved you 10,000 here, and da, da, da. It's like, no, you didn't, man. You're just cooking the books. Like, just stop.
Sarah Palin's right. If we let Obama ruin our healthcare with his socialism, it's going to just empower a bunch of death panels making life or death decisions on people that has nothing to do with medical science and is all about a political agenda, okay? Thank God for the Texas Supreme Court for standing up for the unborn and fighting against a bunch of medical doctors that don't know nothing about science. They just got a political agenda is all.
Hey folks, this is another... Hey folks, this is another video that has to do with Donald J. Trump. Surprise. People are coming in my comments and saying that they would not rise up against Donald Trump because they voted for him. Well, I'm going to disagree with that for a second. If Donald J. Trump gets into office, I don't think that he will. He's not getting in the Oval Office, okay? But we're playing the let's imagine. So if he gets in office, this is for the folks that voted for him mostly. But everybody else, you can listen in. The reason that they would turn against him is because they did not know, despite what they were thinking. So keep in mind that most of the folks that voted for him were not the ones that we were making fun of on the television and on TikTok. When they put the mic in their faces and they didn't know whether they were coming or going. 1 + 1 was 7. It wasn't them. It wasn't them. That's a small percentage of the folks that voted for Donald J. Trump. The reason that they voted for him was because of what we call YT privilege. That's the reason. They need to have that. Okay? So that's the reason that they voted for him. This is why I'm rebutting what folks are saying. Well, they won't turn against him. No, they will turn against him, and this is why. I'm gonna make this video short. I think because when they realize that this guy and his minions and his sycophants and his billionaire buddies collude to take their money, I'm talking about the people that voted for him, yeah, that's when, see, people like me, especially my beautiful black women, they're not in this fight anymore. They're done. They're done what they were supposed to do. And us brothers, we showed out too. But I'm saying we're not going to get out there and fight the way those folks are going to fight. They're going to fight to keep their Social Security, Medicare, and veteran benefits. I'll be out there for the veteran benefits and the Social Security and the Medicare. Yeah, I'll be out there, but not like those folks. You guys think that they did that whole deal on the Capitol on January 6th, 2021? No. So Just keep that in mind for the folks that are saying that they're not going to do it. They wouldn't rise up. They'll rise up. They will rise up. They'll rise up because it's directly affecting them. See, they weren't thinking that them voting for him was going to affect them indirectly. Right? Not indirectly. But now it's directly going to affect them. Oh, by the way, before I get off of here, did you guys hear that Donald J. Trump say that he's not going to be able to do anything about the grocery prices? For all those folks that were concerned about the expensive eggs, that'd be y'all too, the ones that voted for him. Did you hear him say that? He said it yesterday. He's not going to be able to do anything about the grocery prices. They're gonna be where they are. He's not gonna be able to lower them. So there goes that. So yeah, if he gets in office and all this stuff goes down like he's professing, yeah, they're gonna rise up. They might not even need my help. Because they outnumber us. We're only like 13% of the population. I'm talking about black folk. Yeah, they're going to rise up. Believe that.
So a lot of people on social media today are learning that the reason they have health insurance today or in previous years is largely because of Obamacare. And the reason we're realizing this today, it is the 14th anniversary of Barack Obama signing the Affordable Care Act, the ACA, into law. But as those posts suggest, and as a lot of comments on my videos, especially the one I'll link here on ranking America's presidents, suggest, a lot of people don't really know what's in the ACA, like what it did, what it does, and what the outcomes of it are, and why Republicans have failed to repeal it but are still really trying. So let's talk about it. Now, first of all, any kind of healthcare reform or health insurance reform act that actually got passed in the United States was a really big deal, or as the current president called it. And that's in part because American presidents have been talking about trying to reform Americans' access to healthcare for about a century at this point. And we've seen efforts by FDR and Truman and JFK and LBJ, though he did get Medicare and Medicaid through, and Carter and Clinton all go down in flames. And many of those programs were actually opposed by the American Medical Association, the AMA, which accused these programs of being socialized medicine and lined up their troops against them and got a lot of American people very scared about these programs. But the AMA endorsed the Affordable Care Act in 2009. It was a big win, and one of the reasons they do endorse it is because this is not a super liberal program. Barack Obama moved to the right as far as Democrats were concerned on health insurance programs, and he picked up what had been the Republican plan for health insurance reform. This is not Medicare for all. This is not single payer. This is what had been the Republican alternative to those Democratic plans. Republicans like Richard Nixon, Newt Gingrich, and Mitt Romney had supported these types of plans in the past, which is one of the reasons it was really difficult for Romney to run against Obama in 2012, because he had set up an Obamacare-style system in Massachusetts that worked really well, but now he was arguing that Obamacare doesn't work and running against it. What is actually in the Affordable Care Act? I'm glad you asked. So there's 4 big things you need to know about Obamacare. First, it required proof of health insurance, or you would have to pay a tax penalty, and this is called the individual mandate. It mandates that all individuals have health insurance. Does what it says on the tin. It also says that insurance companies can't really charge sick people more than they would charge a healthy person, and that is basically how insurance companies had worked. They would raise prices really high for people who were disabled or sick or high risk, and then that would keep them out of these insurance plans, and that would keep prices low for all these healthy people, and that's how they made money. Now, the idea of Obamacare is the opposite. Instead of kicking those sick people out, we're going to keep all the healthy people in, and the idea is this would keep insurance companies from going through that whole death spiral where they would just collapse. Now, the Affordable Care Act increased Americans' access to health insurance in 3 different ways. Follow me to part 2 for that. So how did the Affordable Care Act, known as Obamacare, actually increase Americans' access to health insurance coverage? Let's talk about it. The ACA focuses on 3 different groups and increases their ability to access health insurance, to afford it, and it also increases what that health insurance is going to cover. So for people who already had health insurance, usually through their employers, it both regulated that coverage and increased who could take advantage of it. And it did this a couple of ways. For starters, it abolished pre-existing conditions, which was a thing when an insurance company would say, you know that issue you're having today that you need some help with? Well, we think that actually started when you were injured 10, 15 years ago, and therefore it is not our problem and you do not have coverage. You can pay out of pocket to to that provider if you would like that medical issue handled. Pre-existing conditions also severely limited people's ability to change jobs or move if they had any kind of chronic health condition, because if they changed insurers, the new insurer would say none of your ailments that are related to that chronic condition are covered. So it scraps those pre-existing conditions. It also scraps junk plans by providing minimum standards that all insurance plans have to meet. In a lot of cases, these were plans bought by healthy adults who didn't regularly go to the doctor but wanted something in case of catastrophe. And then when catastrophe happened, like a car wreck or an unexpected cancer diagnosis, they realized these plans basically didn't cover anything and they weren't worth the paper they were written on. And finally, if you were the parent of a teenager or a young adult, that child could stay on your health insurance plan, usually through your employer, until age 26 under Obamacare. So it made those health insurance plans cover the children of the primary enrollee until they were at least 26. And this covers a lot of college-age people in the United States today, including Anna, who we started this whole series with, realizing that the reason she was able to stay on her parents' health insurance until 26 was because of the ACA. Now, if you remember, back to history class, Lyndon B. Johnson's Great Society included Medicaid, which is government-funded health insurance for the very poor, and Medicare, which is government-funded health insurance for the elderly, anyone over age 65. And the ACA expanded who Medicaid was supposed to cover. So Medicaid is a federal program with federal dollars, but it's largely run by the states, and the states get to decide who qualifies for Medicaid within their borders. And in southern Republican states like where I'm at in Texas, you need to be extremely poor to qualify for Medicaid. And the Supreme Court actually decided that these states under the ACA don't have to expand Medicaid if they don't want to. Even though 90% of the cost of Medicaid expansion is covered by the ACA, by the federal government, these 10 states have still refused to expand Medicaid because they don't want to take those federal dollars to provide health insurance for poor people in their states. Though Mississippi, of all places, just had their House pass with a veto-proof majority Medicaid expansion, and it's going to their Senate. So we can talk about that in part 3. So we've got insured people covered, we've got really poor people covered, but we need to take those people in the middle who are too rich for Medicaid and too poor to be able to afford their own health insurance. And the ACA sets up state-run healthcare exchanges for them. Think of this like Sam's Club or Costco for healthcare. Instead of you as an individual going to Blue Cross Blue Shield and seeing how much it would cost you to get coverage, we take all of the tens of thousands of people in a state who need to purchase coverage this way, and we go to Blue Cross Blue Shield and say, how much would you charge all of us? And so as a group, we pool our resources and it lowers the price. Then the government looks at what a person could reasonably be expected to pay for health insurance based on their income and what the actual cost of it is in those state-run healthcare exchanges. And then they provide a subsidy for the difference, which means they pay the difference for that person to get healthcare coverage. Of course, that individual never actually sees the money. It goes straight to that healthcare company, that health insurance company, but it means they get coverage. The uninsured rate in the United States was 17.1% in the fourth quarter of 2013 before the individual mandate went into effect. By the end of 2016, it was 10.9%. All of these ways to increase people's access to health insurance worked. And as Obama notes here, the Biden administration actually expanded access a bit through the Inflation Reduction Act so that 21 million Americans have access to healthcare through their actions today. For challenges to the ACA, follow me to the next part. On the 14th anniversary of the Affordable Care Act, also known as Obamacare, being signed into law, President Obama posted on social media noting that after it was signed, one Republican member of the House called the ACA the most dangerous piece of legislation ever passed in Congress, and another predicted the country would never recover from it. So let's talk about Republican efforts both to overturn or repeal the ACA. So of course, after the Affordable Care Act was passed, Republicans sued, taking this case all the way to the Supreme Court, arguing that the Affordable Care Act, Obamacare, was unconstitutional. And at the time, we had a 5-4 conservative court, though not nearly as right-wing as our current 6-3 court is today. But in 2012, the Supreme Court found the ACA to be constitutional, largely because the Obama administration knew its history. So all the way back in the New Deal under Franklin Delano Roosevelt, Secretary of Labor Frances Perkins, the first ever female cabinet member, was trying to figure out how in the world they were going to get something like Social Security past a conservative Supreme Court. And she went to an afternoon tea in D.C., not because she wanted to, but because that's the thing you have to do. The tea that Frances Perkins has to go have happens to be hosted by the wife of Chief Justice Stone. And Perkins runs into Stone at this afternoon tea, and they begin talking about the problems that her group is having, trying to figure out how to get the Social Security Act through constitutional challenge. And he allegedly tells her, the taxing power, my dear, you can do anything through the taxing power of the federal government. And so Frances Perkins goes back to her group. They establish the Social Security Act under the government's taxing power, and it withstands constitutional challenge. And Obamacare is also based in the taxing power, and it withstood constitutional challenge. So the individual mandate is largely what made the ACA constitutional, but the Supreme Court did say that the federal government could not force states to expand their Medicaid offerings, even though the federal government was covering 90% of those costs. Several million Americans today remain stuck in this Medicaid expansion gap. They were supposed to be covered under the ACA, but these states have refused to expand Medicaid, and so they are left without coverage. And while the ACA remained in effect early in Donald Trump's presidency, he announced, quote, "I want people to know Obamacare is dead. It's a dead healthcare plan," end quote. He shortened the annual enrollment period of marketplace insurance plans, he cut funds for marketing those plans, and he cut funds for ACA navigators, the people that Americans can call up to help guide them through the different plans and find out which one is best for them. His efforts to sabotage the ACA did have an impact. The uninsured rate in 2019 was the highest since the ACA had been enacted. Then the Trump administration tried to get Congress to repeal the ACA despite the fact that about 24 million Americans would have lost health care coverage if they had done this. And remember, Obama had picked up what had been the Republican healthcare plan, so now they didn't have a plan. They kept trying to come up with something to replace Obamacare with, and they never did. In the end, this 2018 effort to repeal Obamacare failed by a single vote. There were 3 Republicans who voted against it, along with all those other Democrats. They included Lisa Murkowski of Alaska, Susan Collins of Maine, and John McCain of Arizona, who you see here giving the thumbs down next to a very grumpy McConnell. So when that effort failed, Republicans under President Trump tried a kind of sneaky plan to get Congress to change the act enough to get the courts to then rule it unconstitutional. They passed the Tax Cuts and Jobs Act, which included a $2.3 trillion tax cut, but also set the penalty for not having health insurance under the ACA at $0. They then argued that with the penalty set at $0, the individual mandate wasn't actually a tax, and therefore it couldn't be considered constitutional under the taxing power. They then further argued that the individual mandate was not severable from the rest of the act, and that if it no longer being a tax was now unconstitutional, then the entire 974-page ACA had to be thrown out as unconstitutional. The Supreme Court heard this case in November 2020, but rejected this argument in June 2021. Well, the Biden administration has actually tried to expand parts of Obamacare. The Inflation Reduction Act, passed in 2022, actually extends pandemic-era higher-level ACA subsidies for 3 years, ending in 2025. The Republican plan, called Project 2025, calls for completely eliminating Obamacare despite the tens of millions of Americans who rely on it for their health insurance, and it offers no replacement. And that's also despite the fact that Republican-controlled states continue slowly accepting Obamacare and expanding Medicaid, including Mississippi, of all places, whose House just passed Medicaid expansion with a veto-proof majority, sending it to their state Senate for a showdown on whether or not Mississippi is going to accept Obamacare. Follow me to part 4 for that.
Like, seriously, lovelies, if voting against yourself is a person, like, I don't understand. This is just something that a lot of people really need to re-strategize right now, because I think the deed has been done. You know, right from time, there has always been a ridiculous amount of healthcare payments. You know, people cannot even, pay their bills in order to live a life or stay alive, become strong, and all of that. Like, right from time, it has actually been a problem. Upon they now introduced this, affordable care, which they thought is Obamacare and all of that. And I think things decided to be fair for some people and all of that. And all of a sudden, during the course of these elections and everything that has been put in place for this election, a lot of people were like, oh my God, they need to get rid of Obamacare. You need to get rid of Obamacare that was actually that was still serving you. It was serving people that have this chronic illness that cannot even afford it. But majority of people don't like it. They don't want it. They want it eradicated, thinking that they are getting rid of Obama. I don't understand. Was it because it has a nickname of Obamacare, then people were assuming that it is actually meant for people that looks like me? I don't understand, because this is just giving, let's get rid of this in order not for it to benefit this certain level of people. So let's keep this so that this will actually benefit us. It's just what is given without them realizing that it is actually the same thing. It is the same thing. There is a video I saw that really broke my heart. This woman is actually a cancer patient. She's been receiving her chemotherapy for a very long time through affordable care. She's been receiving that. She does not work, she don't have any means, but because of affordable care, she was able to receive all of her treatments. Like, there are cases like that. This woman really have to make this heartbreaking video that I was like, what has people really done? And she was all begging, oh, arrangement, please do not take this out. Because of this, I'll be able to live to this level in life. I've been receiving this has been helping me, please do not take it out. But this is what people voted against. She was all over the social platforms crying. I felt so bad for her. I felt so, oh my God, what has people really done? She was all, so emotional. And I can really tell that affordable care have really become a part of her life. She lived through that. She was all begging. But no, people are so selfish. They voted against it, thinking that they are voting against people that looks like me, or, Seriously. This is just where we have found ourselves. This is it. This woman was like, if you take it out, I don't know how my life will be. I don't know how my life, But the worst part is that during the course of the rallies, before the election and all of that, VP said it. She came out. She was like, if you put this man there, he is going to get rid of Obamacare. He's going to try to get rid of it. But people do not want to listen. Like, what she was saying is just as if she was singing. A lot of people do not want to, understand the rhythm of what she was saying. People were like, oh, please just shut up. We don't want you there. We don't want you. And she keep on telling people things might not be the way you think it's going to be. And people are trying to cast a bird, and you didn't even take a time to read all of the principles that is written there, because both of them has what their policies are. A lot of them wrote what they want to do and what not to do. That is why when people are getting so surprised, I keep asking myself, is it that these people did not understand what he was saying, or they never understood the policies that he put out there? Like, it was just very clear, black and white. You see it clearly. But anyway, people still went ahead to do what they feel that is right. People still feels that, oh, this is still a go-go, even if they saw all of the handwritings written on the wall. They saw it. Nobody would say that they never saw this coming. People knew that this was going to be a problem, but anyways, they voted anyway. We don't care. And the thing is that a lot of people are trying to have this victim mentality and trying to change the narratives. People were like, okay, it's better for me to pay high groceries and remove Obamacare and whatsoever in order to keep the border closed. This is the kind of people that don't want to take accountability. Instead of them to take accountable for their action, they will try to look for a way or a place to change it and to place it and to make it look, seriously. And they were like, oh, we don't care. Even if I'm going to pay all of the high grocery prices and remove Obamacare or affordable care, so far it's going to keep people from entering. This is what most of all of the Maga people are saying right now on the social platforms. Seriously, love this. But the thing is that the people that this stuff is going to affect, they are not even the one that made all of this MESS. Seriously. The problem is that so many people will get found out. So many will FFO. And that is just so bad. I don't know why people that made this decision wouldn't just face it alone? Why would people who didn't make this decision also going to face the consequences of people that made this decision? This life is not balanced. It's not. But even till date, a lot of people have not really realized what is going to happen. We just, keep on praying. I keep telling everyone that the only thing that people are left to do right now is just to keep on praying and wishing that things will eventually get better for the next 4 years or even other years, because I was hearing something that there might not be another election. I had it somewhere, I don't know. I heard it somewhere that there might not be another election. So I think people just need to deal with it for the next 4 years by His grace. And we just really need to look for every means to survive. We just really need to survive. A lot of survival need to take place, because the way at which these things are moving, the way at which things are just drastically changing without even Him being there, is just something that is baffling. I saw someone saying something like they want the government to pause till when He takes over. I have not really, make more research on that. But anyways, guys, I also want you to, put up in the comment section of every other thing that you want me to talk about. Sometimes a lot of you guys send me videos, and I really, 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 really appreciate that fact. I like the fact that you guys brings my attention to happenings, especially on my Instagram. I see you guys sending me videos. Oh, talk about this, react about this. Oh my goodness, it's really giving me a sense of belonging. I really, really appreciate it. Thank you so much for all the love and support, and I will also encourage those of you who keep on sending these stitches on my DMs to just continue. Sometimes when we think that this is what is going on, we don't know that there is another one. Like, you wouldn't know everything. So thank you so much for all the love and support, for everyone who has actually tried one way or the other, for my subscribers, my commenters, people that educate us. We have like educators here on this platform. There are people that encourage me to maybe buy me a copy with super chat and super thanks. To my returning subscribers, thank you so much for all the love and support. And lovely, stay blessed, stay cool, be very, very aware of your surroundings. How the things have really changed, so you really need to be very careful. And I will see you lovelies when I upload the next one. Thank you so much for all the love and support. Don't forget to please subscribe to this channel, share this video, leave a thought in the comment section, and I will see you lovelies when I upload the next one.